Federal cuts are hitting home for hundreds of employees at the Minnesota Department of Health. MDH says about 300 employees received layoff or at-risk notices today. That action comes after the federal government slashed more than $220 million in grant money last week. WCCO's Kirsten Mitchell explains the latest impact.
It's going to be a lot of really hard goodbyes.
After 5 years at the Minnesota Department of Health, Lydia Fess is now counting her days.
I'm waiting to hear if that notice is definitive.
Her epidemiology department was gutted by layoffs at a time she believes their work is more critical than ever.
The things that we are doing are so that people don't have to think about measles and H5N1 and syphilis and HIV. And as we're not able to do that work, really the burden is shifted not only to the employees that are left behind, but to all of the Minnesotans and Americans that are affected by those diseases.
She's among 300 MDH employees impacted by cuts to pandemic-era federal grant money.
We did not want to do this. We were forced to do this because we are so heavily reliant on the federal government. And the federal government has made key decisions now that will impair people's health.
Health Commissioner Dr. Brooke Cunningham says more than 180 partners relied on the funding and will have to end their work, including free community vaccine clinics.
We are rolling back in many ways to pre-pandemic times and ways of working, to our detriment.
She says the cuts will also reduce nursing home support, slow infectious disease outbreak response, delay lab results and patient care, prevent upgrades to the Minnesota Immunization Information Connection, suspend the Inspire program for students, and cut funding for tribal public health.
The ones who call us because they're scared because they had a bat in their bedroom and they don't know if they need rabies shots, I'm thinking about them.
Lydia says she's always wanted to work in public health, but now doesn't know if public health will work for her.
I don't think there's much of a public health to continue in, to be quite honest. The federal jobs are being decimated. We're all going to feel this, and that we really need to be there to support each other.
In St. Paul, Kirsten Mitchell, WCCO News.